All right, welcome everybody. This morning we're going to talk about something, I've touched on it before with respect to genetics, but I just was talking to a patient yesterday. It was top of mind. So when you're living in certain environments, so maybe an older home, maybe one that you know had a water leak, or there's a problem on the sink or in the shower, and you actually see mold, that will affect whether it's you personally or a loved one differently. And part of it is each of us inherits a set of genes from our parents, the X and Y chromosomes, and some of the ways that we find it difficult to understand why one person is doing or having a difficult time in an environment has to go back to that. So for instance, I don't methylate well. Many of you know what the MTHFR gene is, or may have heard about it. Methylation is a chemical reaction, adds a methyl group, and it's very helpful with something like, we'll say, DNA repair. So if you don't methylate well, and you go through a stressful event, a difficult workout, a illness, injury, you twist your ankle, but something as simple as the common cold, which is typically viral, caused by the rhinovirus. After you recover from the virus physically, you may feel fine, you're not tired anymore, your breathing's fine, but you may have a persistent cough. And so I tell this story because this happened to me actually when I was in medical school as a fourth year student, I believe. I was with a whole group of students, and the consultant physician who was teaching us about infectious disease at that point. We were seeing patients, and it was about 2 weeks after I had been sick with a cold, and I felt fine, but I still had a cough. We were around the patient's room, and I had to step completely away from the room and the group because I was about to cough. It was going to be obviously loud, so I moved away, and I coughed, and it went on for a little bit. I was embarrassed because I didn't feel bad. I didn't know how to resolve it. So the infectious disease doctor at that time actually said, what's wrong? And I told him what had happened, and I felt fine, but I still had this cough. And so he listened to my lungs and asked me some questions, and ultimately he said, well, you probably have a problem with residual inflammation. And he actually helped me with something that was an inhaler to help with that. Now, in retrospect, I think that boils down to a couple things. Like, although my body has an ability to recover, about 40% of the population have this issue with methylation, and that's why many of us have this prolonged bout of inflammation after we recover from any kind of viral illness. And so this went on after each time I would get ill over the next several years, and year over year, actually now decade over decade, I've learned more and more and more about myself personally by looking at my own genetics. And so I've had my genetics tested through all sorts of companies, most recently Envision Labs, which is the vendor we use now, because we feel they're currently the most comprehensive. And so, what does that, really mean? Well, the genes give you the blueprint, if you will, for everything. And so I know I don't methylate well. So what's my strategy to work around that? Well, one of the main things I use is a methylated B complex vitamin, and because it's methylated already, because of my limitation genetically, I then don't have to methylate it. So that's just one example of, me personally, and I've had difficulty with inflammation and post-workout inflammation, staying sore longer than expected. Most of my entire young adult and adult life into my 40s even. Now in my 50s, I work out not as often as I used to due to my schedule, but I work out and I don't stay sore for long periods. I don't work out as intense as I used to. I do things for flexibility and mobility, but I still do strength training, but I don't have prolonged bouts of stiffness, soreness, because I'm doing a much better job with, number one, my sleep, getting enough quality and quantity of sleep, my HRV, heart rate variability, which helps measure recovery, is actually getting better now as I get older. I'm doing things specifically with my breathing and with my strategies during the day to manage stress, eating correctly, not fasting, probably as long as I used to in the past. So all those things, I think, in my personal case, play a component. So, genetically, we are given a certain amount of capability to perform these reactions that relate to detoxification and specifically support immunity. And I just want that to be top of mind because I get patients asking me why there's differences between themselves and maybe their spouse or loved one, even though they went on, say, the same trip, for instance, or they ate the same foods. Now, everybody will react differently, based on their genetics, so as it pertains to methylation, but they'll also act differently as it relates to food based on each person's individual characteristics in their gut microbiome. Many of my patients are facing different imbalances in the gut microbiome, like SIBO, so there's a bacterial imbalance, there may be a candida imbalance, and this is something that we are seeing more and more and more, is a parasitic imbalance. And that can be, yesterday I spoke to a client in Hawaii. Anytime you consume any raw fish like sushi, you're going to expose yourself to more parasites. So traveling, in and out of different countries, because the water is going to be, from a filtration standpoint, have different levels of bacteria, parasite components. And so this is just something you have to be aware of. Just like if you went, for a hike and you were going to drink water out of a stream, you would definitely have taken steps and brought something with you to filter that, both from a, like sediment, gross sediment standpoint, or like, like sand, but also for parasite, because a classic example of a parasite you would get from drinking water out of like a stream somewhere is Giardia. So all these things are really, they're obviously, things we're concerned about, we see in our patients routinely. That's why we're very, very adamant about workup pre-op, looking at your genetics, different aspects of toxicity, gut microbiome health. All those things are extremely important in running the SHARP method. That's meant to prep you for any type of surgery, but as it relates to what I do is predominantly explant surgery. It also can lower your inflammation if you're not quite, in the position to have an explant. So if you're just thinking about, hey, I have implants. I've had them for a period of time. I have some of these symptoms. I don't know if I'm really dealing with the inflammation like other patients are, and I'm otherwise happy. I just want to lower my inflammation. The SHARP method helps to do that. So in my book, I describe, much of my, methodology and philosophy about looking at genetics, how that relates to our, inputs. So environmental toxins, you have to be careful, and you want to really think about your environment in a way that, one, you can feel as good as possible. So yesterday, in fact, talking to this patient in Hawaii, they lived on a golf course, and there are a lot of people around the United States who live on or nearby courses. Courses have to be sprayed. One example I have of a patient getting exposed to a chemical is atrazine. That was one of the things that used to be sprayed on golf courses routinely. Atrazine causes all sorts of issues with inflammation and toxicity. So that's just one, thing. If you live near or grew up around agricultural environments, crops, there will be things like glyphosates. So all these, that's what's in Roundup, is glyphosate. So there's all sorts of examples of where our environments contribute to issues. I recently had a patient have a high amount of a heavy metal called barium. And so barium is something I'm familiar with from my training. It was used to really look at patients under x-ray to look for problems with swallowing or, any issues of blockage in the GI tract. It's, it was actually in the 90s used, very frequently, probably less, nowadays. Even when I was training, things like gastrographin were being used instead of barium, because barium would affect being able to view a CAT scan. But so there's all sorts of things that can be in your groundwater. Specifically for me, I had a bunch of arsenic in my groundwater. So, fast forward, what's important is, from a toxicity standpoint, if you have one of these issues, it's important to, think about, your intake. So air we breathe, filtered air is important. I live in an environment where there's a lot of problems with oak, cedar, and mold, other pollens. These are all things that, if you have a lot of reactive airway issues, that they can stimulate you and give you a cough. They can give you itchy red eyes. I do get that frequently. From a fluid standpoint, what you drink your fluids in. Try to drink, filtered water. Always, you want to drink it out of something stainless or glass. If you have the ability to control, financially, your input in terms of food, try to get as much, if you're eating animal protein, grass-fed, grass-finished beef, and if you're getting poultry, make sure it's non-hormone, pasture-raised. Other, meats or organ meats, you want those to be organically sourced, grass-fed, grass-finished. In terms of fruits and vegetables, you have to be very careful. Thin-skinned fruits can absorb, like I was mentioning, glyphosate. So you want to get organically sourced fruits, and be careful with how many thin-skinned, fruits you're getting. You can have elevated level of glyphosate because of that. I had a patient who grew up in California in the agricultural area, and as a child would fly under the crop duster and would get sprayed by the crop duster, and to this day still has elevated glyphosate levels. And so, the recommendations for those will always be to work with our detox team to help get that out of their system. And you just have to begin. All right. Remember to submit any questions you have about this. Make comments. I'll reply to all of them to the best of my ability as quickly as possible.